Welcome back. If joint pain is creating havoc in your life, or maybe you have pain but don't really know where it's coming from or why it's there, you're going to want to hear about Caring Medical Center. That is where you will find Dr. Ross Hauser. He is a prolotherapist, also the author of this book, Prolo Your Pain Away. Good morning, doctor.
Good morning,
glad to have you back.
Hey, you too.
I always learn so much about you. I know a lot of people are learning about prolotherapy, which we're going to dive into here in just a second. But one of these things I had not heard of yet, but I think maybe causing people some pain is this bursitis. Is that correct?
Yeah, the body has a lot of fluid-filled sacs. They're called bursa. Like,
okay.
you have a sharp bone here in your elbow. There's a bursal sac there, so the skin can glide over that bone. Or in your hip joint, there's a bursal sac between the big bone here and a muscle called the gluteus medius muscle.
I think we have a graphic that might, because sometimes these things are like, okay, where is it? It's a little anatomy, a lesson here. So kind of explain again, it's those, there it is right there. So you can kind of see, do those get inflamed? Do they, what happens to them?
What would happen is when the joint becomes unstable, the muscle then starts rubbing too aggressively onto that bursal sac, and the bursal sac becomes inflamed. And often people will take anti-inflammatory medications or get cortisone shots to try to get rid of the bursitis. The bursitis doesn't go away, or the pain doesn't go away, because again, I said the bursal sac is getting irritated because the joint's moving too much. And the joint's moving too much because the ligaments are stretched out. Ligaments are what connect the bones together. So whenever you hear cracking in your shoulder, cracking in your hip, cracking in your neck, it means that the joints are too loose. So when you have a cabinet that's loose, you have to screw it in. So the treatment to tighten the joints, to regenerate the joints, is called prolotherapy.
Yeah. Well, and when it comes to bursitis too, I guess, can you get it anywhere where there are joints essentially in the body?
Yeah, there's hundreds of bursal sacs that can get irritated. But again, when it occurs over and over again, or you got a cortisone shot, or you take anti-inflammatories and it's not resolving it, you should think about, well, maybe I should get prolotherapy because the underlying cause is not being addressed by the anti-inflammatories.
Well, and how can prolotherapy help? Explain what exactly that is, what that procedure is.
I'm a prolotherapist, which is a regenerative medicine specialist. So whenever you hear the word regeneration, think about prolotherapy and a prolotherapist. Prolotherapy is a regenerative injection technique where we utilize natural substances that stimulate the repair of painful areas. So if you just think about pain, is that there's a weak structure, and that weak structure isn't healing. The body's not healing it. So I need to have the healing process restarted. The injection technique, and again, we use natural substances, the injection technique to regenerate a ligament, a tendon, cartilage, the meniscus, the labrum in the shoulder or the hip, is prolotherapy.
Well, and it's interesting, you were saying that sometimes you're kind of the last resort doctor. You know, people have maybe tried other options, but you say maybe don't wait till that. I mean, surgery may not have to be an option. It may still have to be an option for some people, but this is something to consider maybe before you try some other things.
Well, things always have to make sense. So I mean, if you take like say ibuprofen, just for, everybody understands what that is. You know, pain's not an ibuprofen deficiency. Pain, normally it's a structural problem. You know, you have a structural problem in your elbow. So there's something in your elbow that needs to be repaired or strengthened. So if you have a tear, if you have a strain, if you have a sprain, you know, there's something loose or weakened, so the injection technique to strengthen that is prolotherapy. Well,
and it's interesting, too, you were telling me a lot of people have the correct diagnosis. They know what they have, but it's just that, of how you get the options to feel better.
People don't really understand. There's even doctors who never heard the term prolotherapy, because we're the first full-out prolotherapy clinic in Southwest Florida, so don't be surprised when you hear the term like prolotherapy. What folks don't realize is I've been doing it for over 20 years, wrote over 30 scientific papers, written 7 books on it. So just know there's a lot of information, scientific information on prolotherapy.
And there's been great results with this. I know with your patients and stuff, which I know is very rewarding for you. And again, I think that's why you've moved to Southwest Florida, to maybe spread that around.
Yeah, exactly.
Give people more options. Well, if people are watching this morning and they think, I don't know, am I a candidate? Will this work for me? What would you suggest they do?
Obviously, the best thing is to come in for a consultation. And if you want to, so we have an office in Southwest Florida, or go on the internet, www.caringmedical.com. We have a center in Chicago and then a center here now in Southwest Florida.
And we are so glad that you do, and we're so glad that you're coming on The Blend to tell our viewers about it. Again, a lot of people listen to that prolotherapy. It's going to be creating a lot of buzz here in Southwest Florida. We appreciate it, Doctor.
Thank you so much.
For more on his office, all you have to do is head to our website, fox4morningblend.com.